As people start to trickle in, we'll get started. My name is Corinne Waldo. I'm the Senior Director of Economic Vitality for the Boulder Chamber. As of tomorrow, we're hitting our 1 year anniversary of doing these webinars together there, Lane. Today is the April 29th version of the cross-industry updates for businesses, and we'll have an update on what the schedule will look like going forward. We're probably only going to have one more of these, and then they'll be available as needed moving forward. But we'll continue to send out information and emails moving forward. So that schedule we'll talk about at the end. In the meantime, I'm going to hand it over to Lane Drager with Boulder County Public Health.
Thanks, Karen, and thank you all for joining. We're going to run through a very similar agenda as we have. I will really focus on the EPI information, share where things are at, and we have not had any changes in any kind of orders or regulations. I'm really going to just talk a lot about vaccinations and how important that is, and then we'll talk a little bit about 5-star and again have plenty of time for questions and answers. We are still in blue as far as looking at the dial that we've been tracking for so long. That is in effect still in Boulder County. We are under dial 3.0, but as a local regulation. So this map of the state, all the green counties are ones that have done similar things to Boulder County of putting a local public health order in place for the interim, really to get us hopefully to higher vaccination levels when the state removed their statewide orders. And we still are looking at the metrics that the state was tracking. So where we're at with our overall incident rates for the disease, it's been, again, a little bit more stable. We're at a very similar level to where we were last week. We're about 137. It was a little higher earlier this week, but it was about 141 last week. So not still dropping like we would hope, but still doing relatively well compared to the rest of the state and the rest of the metro area. Our positivity rates, again, seem very similar. We were about 4.4 last week, 4.2 this week. A little bit of an uptick in overall number of tests, so that's good. And then again, very similar where we're at with the hospitalizations. So 10 days versus 11 days last week, and it's again keeps kind of fluctuating in that general area. Here's again that epi curve. You can kind of see a little bit of a plateau, but at least not another uptick from where we were a few weeks back, but still substantially higher than where we were earlier this year. So again, it's just an interesting curve of what's happening, but our mobility has been the driver, obviously, the more activity that people have had while still not necessarily being vaccinated. Here's that breakdown I've been sharing throughout our seminars of what's happening across our municipalities. You can see again that fairly flat the last 3 weeks and very similar trends, 35% of the cases in Longmont, 33% in Boulder, so a little bit more representation in Longmont now. Boulder, 161 cases, Longmont, 174 cases, Lafayette, Louisville, and Superior, 92 cases. And then our other municipalities and in unincorporated Boulder County represent 63 cases. Again, we're still tracking our disparities across the county, and we still are seeing that persistent disparity within the Hispanic and Latinx community. You can see here, again, that tracking over time, that, again, that plateauing, but again, the last few weeks, a little bit more of an increase in that disparity. Oops. Here's where we're at vaccination wise, doing very well within our community. So a little over 65%, over 179,000 residents vaccinated, and that is great. Here's where we're at, breaking down those into age demographics. So our big push for vaccines really is the 16 to 50-year-olds. That's the group that we still need to get our percentages much higher. And really right now we're seeing a lot of the disease in our kids who can't be vaccinated, 0 to 9, and then certainly the 10 to 16 also are representing a fair bit. But then, that that 19 to 40 and 50, those are age groups that we really need to see a much bigger uptick in vaccinations. And we are still seeing, similarly with our disease, we're seeing the disparities in vaccination. So again, that's the target for the clinics that Boulder County is running and hosting. We are continuing to track where we're seeing our vaccination rates doing well, as far as, and also those that are lower. So those are, again, where we are also trying to target our clinics. Want to make sure folks have all the resources they can get. This is that state website and the state number that I've been sharing for a long time now, but I still want to plug that. It has great information across the state of providers for vaccine, and also ability to answer your questions. And I think we all know this, but it's always good sometimes to have the data that just echoes what we hopefully all know, is that vaccines work. And so what this graph shows is it's the 10 largest counties in the state. And so as you see higher vaccination rates in those communities, you're seeing a direct correlation to lower disease. So we're very happy to be way over here on the lower right with Jeffco in Denver. And we all have very good vaccination rates, certainly relative to our peer counties. And when you look at that, we also have much better disease control than certainly El Paso, Pueblo, Weld, Adams. So it's a big deal, and it makes a difference. And we knew this is the solution we've been waiting for. And so for people not to go out and get it, it perpetuates this disease and allows these variants to continue to potentially plague us, and possibly even create a variant that our vaccines will not be effective against. We have not seen that here, but we have seen it globally. And so it is very possible, and we've got to get vaccinated and be done with this thing. So it's very, very important. So again, here's just bullets, what we talked about. I'm not really going to spend time reading these again, but for those that may watch it as a webinar, they'll have this to come back to and look at. But really what we're continuing to track all the various metrics, looking at what's happening in our community, and again, trying to target how our prevention efforts can be most successful. Oops. To get into where we're headed, and we have no sense that we won't be, is as of May 16th, we're expecting to move into the clear status, which really is back to relative normal and the new normal. We are expecting a decision on the mask order next week, and I am expecting that to be extended. So that would be the one thing that will likely continue into the summer, is still requirements for masks indoors. This is that metric that really tells us that we're staying in clear, excuse me. And that you can see here, this blue line represents that level that we don't want to see us exceed, and that would jeopardize kind of us being in clear. And the only time through this pandemic that and Boulder is the lower line here, and the Denver metro area is the larger line. So the only time we exceeded that 2.0 was in our November outbreak and surge. So since then, we've been below 1, and we expect that to stay low. As we continue to see vaccination levels increase, we don't see the threat of us going back there. So again, very little chance, barring some variant issue, that we will have issues that would jeopardize clear. So again, everybody in the community can help ensure that by going and getting vaccinated. So this is just a slide summarizing what I just shared about where we're headed. So until August 16th, we'll be continuing to monitor that. But after that, we expect everything will be done, and we'll be, again, back to as normal as we can be. That being said, we don't expect COVID to just go away. Like seasonal flu, we typically have a season, and then we don't see flu throughout the summer. COVID has not been that case where it just kind of dies off and goes away. We've perpetuated it in our communities, so it likely will be something that we have to deal with, but we will have vaccines to help us deal with it. So that's the that's going to be the important piece. This is really the same things that we shared last week. I'm not going to spend time, but again, if people haven't seen this, they can see those slides. There are some nuances for 5-star related to where we're still at for the next few weeks, that they do have some added benefits beyond just being in blue. They can operate in 5-star clear. And it really is the restaurants that I think see the biggest benefit still for the 5-star. And this is, I think, the latest update on 62 certified businesses. So Corinne, any other 5-star updates you wanted to share?
No, they're going around and recertifying businesses based on the new checklists. Businesses that were 5-star certified are continuing to stay. Most of them, all but one, continue to stay 5-star certified and are seeing the benefits of closer tables and some of the benefits of being in a 5-star clear. So if you have any questions about your 5-star certification or the program, please reach out to me. Otherwise, it's still an active program here in Boulder County.
And I would encourage folks that have been thinking about it, it definitely is a proactive step you can take to mostly protect your staff and certainly provide that assurance to the community that you really are on top of preventing disease within your business and encouraging them to give you patronage. The other thing that we've been sharing is, again, the notification system. So another tool that will help us early identify potential risks and exposures. And the schedule you've been seeing for a long time, I think our big updates, Corinne, if you want to share kind of the plan for the schedule, at least for the next month.
Sure. So we will not have a session next week, even though there will be a mask order update. There will be not really anything else updated. So I will send out the mask order updates to you via email, but we will not have a session next Thursday. We will have a session May 13th, which will be prior to going to all clear, which will answer the questions about the masks, any nuances to the masks, any questions about going to all clear, if, pending all of our hospital numbers stay as low as they are. We will use that session to kind of really understand what clear means. We'll make sure that Lane goes through, some of the what's a requirement versus recommendations. We'll try to hone in on some of what are the continued recommendations that we have for businesses to, COVID hasn't gone away. What are some of the continued recommendations for businesses, even if they're not requirements? And then after that, we're probably going to continue the email communications on updates on resources, information, any guidance, best practices, answer questions. I'm sure there will be continued places for businesses to ask questions. My email address is not going anywhere, but we'll just only have sessions as needed. So at that point, I think May 13th will be our last session, and unless we need sessions after that. So today, then May 13th, and then after that, it's only as needed. We'll send that out in an update next week with an email, but just wanted to give everybody an update. We've been doing these for about a year. We've done 197 of them with the Latino Chamber as well. I think there's been 197 sessions done between these and the Latino Chamber sessions as well. So it's been a great ride with Boulder County Public Health and a great partnership. But I think at this point, we're starting to see very few changes, and there's really a lot of opportunities and places for people to ask questions. And we want to continue to have those opportunities, but we're not going to do these webinars as often. So.
Thanks, Corinne. And then our contact is still the same. I don't know the longevity of the call center. I think at some point it likely will also sunset, but it will likely stay in place maybe a little longer, past when our webinars are ending, but that is eventually going to sunset as well. And with that, we can jump into any questions folks have.
All right, we have a question about the mask mandate. You said that you expect the mask mandate to be extended. Do you think there will be any modifications to it, such as for indoor tennis or sports, for groups less than 10, for fully vaccinated people? Do you think there will be any kind of any kind of modifications made for the mask order?
I think we're going to look at all the nuances to make sure everything is addressed. I don't expect significant changes from how it's operating now, though. So I don't foresee anything like what the state has done to say if there's this many people that are vaccinated, because determining vaccination status is not the easiest thing. People are, it's already a challenge with a lot of the nuances here, but so I don't expect that. I would expect that the mask requirement will be very similar in operation as it has been. So I don't expect that. But they're looking at all the nuances to make sure when the state, if their order goes away, that we've got everything covered, so that what's the distance if a performer or speaker is unmasked, how far away do they need to be? So trying to make sure all those things are very clearly outlined.
And right now, there are no exemptions right now for fully vaccinated individuals to remove masks in Boulder County, and you don't foresee that being the case in a public setting, non-private setting.
Yeah, indoors. So again, outdoors masks are encouraged, but indoors I expect masks will still be needed. And the risk is just much greater indoors. And being vaccinated doesn't mean you can't spread the virus. You can even get sick. Very few illnesses and mostly asymptomatic people that are vaccinated, but they can then share those variants with others that are not vaccinated. So the spread risk is still there. It's just the risk to the individuals of getting ill once you're vaccinated is very minimal, if not non-existent. So that's why vaccines protect you and masks protect everyone else.
Okay. When heading into clear status, indoor fitness facilities, when we're looking at HVACs, will they be allowed to use their stationary and oscillating fans again?
Yeah, we will have no requirements. We would probably still encourage you not to, but you would be allowed to do it. So all the things that have been successful throughout this whole pandemic and public health orders, those are the recommendations we're going to still have you encourage, to do. Looking at illness within your employee base is always been important. And so doing that as we move out of these orders and into clear is still important. It's going to prevent disease within your staff, which means you have less people that are out sick, as well as certainly how they interact with your clients and potentially spread disease. So hand washing is still very important. So the only order we expect, only requirement will be around masks. All the other things we would still encourage you to do. They've likely kept you successful and prevented disease. So we would still encourage you to look at those. Maybe
Like symptom checking, your employees not coming to work when they're sick, not letting guests or customers coming in when they're sick, things like that. Those are all, probably best practices and recommendations to continue because COVID isn't gone.
Yeah.
So in level clear, are we still requiring quarantine? When people are exposed to the virus, quarantining isn't part of the orders. Quarantining is part of still disease management, correct?
Yeah, I don't expect anything to change there. That's how we control disease spread. And this, so quarantine and isolation have always existed. I know people probably have not had as much opportunity to see it or hear about it because hopefully they haven't been sick with diseases that have needed them to quarantine or isolate. But these are things that we've done in public health for a long time for communicable disease that humans can spread to each other. So those will still likely be in place as long as we're dealing with disease, because that's how you prevent spreading that disease to others is quarantining. And for vaccinated folks, it really is going to depend on what variant they're exposed to, on whether or not they're quarantining. But we're certainly going to look at situations and still encourage people to minimize those risks or go get tested to verify that they really did not end up getting the virus, even though they were vaccinated. Because again, seeing asymptomatic people that are vaccinated, so they would not expect that they're ill, but they have the virus. So.
And come May 16th, it's really not business as normal because there are a group, particularly under 16, that aren't vaccinated yet. So there are still a lot of hesitant individuals, maybe parents, about going out and being in large groups or going out and going about daily life regularly, because we're seeing a lot of disease incidents in younger folks. There may be immunocompromised individuals in our society. So we're probably not going to want to return to business as normal. We still want to show some public health safety in our businesses and in our lives. So don't open the floodgates basically on May 16th. Continue to follow some best practices and recommendations, correct?
Yeah, I think Colorado is not necessarily doing well nationally in where the disease is at right now. So I think it is important for people to know that when the orders go away, it didn't mean everything is gone and done and there's no more COVID. So it is really important. And these practices work for flu. They work for other respiratory diseases that routinely people get sick and are missing work for. So illness policies work, and they're things that we've always encouraged businesses to have and use.
But what's happening now is now it's a business decision. It's the decision of the business, and it's not in the orders
Yeah.
to take these safety measures, to continue to have 6 feet between equipment, to continue to health check their employees, things like that.
And
We have a question about testing because you specifically asked about variants. What are the sites that specifically test for the variants?
our county-run sites are doing variant testing. Otherwise, there's a percentage of samples that are being screened at the state level, but not every test uh, is being analyzed for the variant.
So the county-run sites are the Stasio ball fields and the uh, fairgrounds, correct?
Yeah.
So the Mako sites.
And I think the other, thing I was gonna share is that it's just important for people to understand that we're never going to be done with COVID, is like, as far as it's around. So these precautions are helpful and are going to prevent things. And businesses can be proactive or reactive, so if you end up having an outbreak, we might still need to close your business, so taking the proactive steps to prevent it from happening helps address less need for the reactive, which is the quarantine, isolation, and possibly, if it's a big enough outbreak, closure of a facility. So again, take the proactive road and don't have to be in the reactive mode.
That's a good question. So if you have more than a certain number of cases in a certain number of days, that's still considered an outbreak even after May 16th, correct?
Yeah. So again, we have teams that have investigated communicable disease, for a long, long time. And so as we see incidents of disease, especially ones that are of high enough concern, we have to take action to prevent that disease. So we still can require businesses to close. We can take those steps. So it's in your best interest to never get to that place where we have that significant amount of disease transmission happening.
And to understand who's working with whom and contact tracing and some of those items. As long as disease is still present at this level in our society, to understand these types of situations is to the best interest of the business. It's just no longer required.
Yeah.
Okay. So there's a question about complaints about businesses and mask rules and whether or not those businesses are investigated if there are complaints, and even if it's a 5-star business. And we can talk a little bit about when a complaint comes in, what we do as far as investigation. But can you talk a little bit about complaints and how those still operate?
Yeah, so we still have a team that's responding to complaints and doing investigations. It's triaged based on the nature of the complaint and how egregious and serious it is, as well as certainly looking for patterns of noncompliance. And so we have businesses that have gone all the way into court order compliance issues. So we've had businesses that have been closed. So they are pretty few, but I would say our business community has been outstanding and has done an amazing job, but we have had some that have really not done it and not stepped up. So we have addressed those. And if it's a 5-star, they similarly have that same level of screening and they can lose their certification. So it's taken seriously at all levels, but 5-star has that additional benefit that can be taken away. So we are looking.
And if this particular business, is mentioned, We work in coordination with public health. So if it is coming in as a public health complaint and public health is doing the investigation, then we wait for public health to complete their investigation and then make a decision as a compliance committee under the 5-star. If it comes in under a 5-star complaint because of a 5-star piece, then we actually go out and investigate under the 5-star and can decide whether it's a warning or and a second warning, we actually pull the variance. So if there is something that's being currently under investigation, it might currently be in that process right now. We have gotten very few complaints under the 5-star businesses. We've gotten a couple, but very few. And some of them are outside the control of the business. In some cases, it's outside the 5-star certification, or it's something that can't be in the control of the business. It's something that's, people are crowding down the street from the restaurant, or, things that the business can't actually control. So it's not really something that we will enforce on. So, but yes, everything that comes in, I get all the 5-star complaints and work directly with Lane. Lane works with his team on the public health complaints. Any other questions out there? I did get a question via email. Between now and May 16th, if an office or a manufacturing facility that's at 75% capacity wants to have some sort of team training or team meeting, what are some of the guidelines they need to follow?
It's really the same components that they've been in under blue. So if it's going to be in person, they need to certainly have a space that's large enough to accommodate it and allow for both masking and social distancing. Where you can do it outdoors, that's going to be much, much better and going to be much lower risk, and potentially allow you to remove masks if you can socially distance. And again, where you can still do some of those things virtually, we would still encourage you to do that. But otherwise, yeah, it's not prohibited. It's just based on having adequate space and location to accommodate and have it done as safely as possible.
In some cases, it may be considered an event if they're going to an event facility and operating as like a retreat type of thing at an event facility, and then it might follow indoor event guidance.
I mean, it's what it sounds like to me. But again, if it's just part of your normal business where you do these things, it may not be an event, but all the same things, when you look at those, apply. It's like, how are you reducing the risk based on what you're doing? So even though there's been a lot of different sectors, it all boils down to that, is how are you trying to minimize the risk for whatever thing that you're trying to do.
Space, space, space. You can't fit the same number of people in the same size space anymore right now if you're going to try to keep the distance.
Yeah, fresh air, breathe fresh air and not each other's breaths.
It's beautiful out right now, although with Colorado weather this month, we don't know from day to day whether it's going to be 20 degrees or 80 degrees. Any other questions out there? And thank you for all of the notes in. We appreciate that everybody has seen value to these and these webinars and to the emails. And I think we've gotten thousands of questions in. I think between the phone lines and the emails, I like the fact that people have asked questions. I think that's helped disease control and prevention in our community. I value that we've been able to play this role because it has helped answer those questions. And I think a lot of communities haven't had this resource for their businesses. And I'm very glad that a year later, we can say that we put it together and we've been able to do this. So another question, how many more of these sessions we'll be hosting? We'll have one more, May 13th. That will be the last formal session. Again, if something comes up or there's an industry that needs to address something about masks or something, Wayne and I know each other's number. We can figure out we know how to put them together if necessary. But the last formal session will be May 13th, just before we go to all clear and after the mask order has gone into effect. It doesn't mean I won't continue to send out emails with changes, resources, information, the information that you need to know. And that doesn't mean you can't ask your questions. We're just not going to do these as a regular weekly webinar. All right. So I don't see any more questions coming in. Everybody gets a half hour back in their day. Thank you, Lane. Thank you to everybody that showed up this week. We will have the recording available to people. And we will see everybody on May 13th for our last formal, official, scheduled session. In the meantime, I'm getting my second vaccination next week. I will be fully vaccinated. Encourage everybody to get the vaccinations. There are walk-up appointments everywhere now. And there's plenty of opportunities to get vaccinations. So encourage people to get vaccinations, because you saw that line. The greater the vaccination, the lower the incidence in our community, and the more we can go back to that normal. All right, we'll see you May 13th, Blaine.
Thank you.
Bye.